Benefits are restored after the shutdown. Recipients are being told they'll need to reapply to the food aid program. The Trump administration says it's a way to crack down on fraud. No word yet on how or when the reapplication process would happen. SNAP serves about 42 million Americans. State administrators already require those who get benefits to recertify their information as often as every 6 months. Well, Congress is back in session after that 43-day government shutdown. Here's a live look of the Capitol. This was a period that tested Americans with uncertainty, stagnation, and it could happen all over again. The deal keeps the government open through the end of January. Meantime, funding for the Affordable Care Act subsidies expire at the end of this year, at the end of 2025. Democratic Congressman Laura Friedman out of Glendale joins me live now to talk about what's next. Good to have you, Congresswoman. Thanks so much for being with me tonight.
Thanks so much for inviting me to be here.
Let me start with this. Are you disappointed in the deal?
I'm disappointed that I have up to 50,000 constituents in my district alone who are getting renewal notices for the ACA and facing huge spikes in their premiums. That's what I'm disappointed about. And I will continue to work. I will try to work across the aisle to work to bring down the cost of health care, because people need to be able to see a doctor. People shouldn't be facing medical bankruptcies. People need to have insurance, and people should be able to receive health care in this country regardless of their income status. And that's what's concerning me right now.
Yeah, I mean, by many accounts, premiums will at least double, and that could happen within a month and a half. Again, these subsidies expire at the end of 2025. So specifically, take us behind the scenes. Is there any more light at the end of the tunnel from your perspective that will change the future for these subsidies, whether that's modifying them, extending them? Is there light at the end of the tunnel?
Well, look, I've been very clear going back many months now that I can't support an agenda or a budget that rips healthcare away from millions of Americans in order to give tax breaks to billionaires and huge corporations. And that's what has been in front of us for months and months. Unfortunately, the Republican caucus here in Washington has been unwilling to make any modifications at all to address these huge spikes in healthcare premiums. They've taken $1 trillion away from Medicaid, which is going to hit our hospitals really hard. That's Medi-Cal here in California. So it's a real healthcare crisis in the making. So I am really concerned, but I will say that this does not just hit California, and it certainly doesn't just hit Democrats. Some of the worst of these healthcare cuts are going to impact red states. And so I got to believe that every representative wants to make sure that their community is healthy and that people can thrive, and that that affordability is something that's available to everybody's constituents. So I'm very hopeful that as these cuts start coming and as people start getting that sticker shock and start not being insured because they can't afford the premiums, that my colleagues will come to the table.
Okay, so you really don't think then come the end or the start of the new year of 2026 that there will be any more compromise by the Republicans?
They have not come to the table so far. They've been unwilling to address any of these concerns about health care whatsoever.
So if I'm a constituent of yours, I know you represent Glendale, West Hollywood, parts of LA, what do you tell somebody who says to you, you know, what am I going to do?
I'm going to keep fighting for people's health care. I'm going to fight for the ACA so that people have tax relief and people can afford the ACA. I'm going to continue to fight for Medicaid. We work every week in my office to get people access to the VA, to Social Security, to Medicaid, to all of the entitlements that people deserve. And I take affordability very, very seriously. And I'm a cancer survivor myself. And I know what it means for somebody to skip a doctor's appointment because they're afraid they can't pay, or to be worried about being able to access medication or afford their prescriptions, or take a sick kid to the hospital or to urgent care. And no one in this country should be in that position. I believe that healthcare should be a right in America, and I will continue to work to make that achievable for people.
Well, I'm glad that you are a survivor when it comes to your cancer diagnosis. So thank you for sharing that. And again, I appreciate you taking the time out tonight on this Monday. Congressman Laura Friedman, thank you so much.
Thank you.